Welcome back to the audio guide from Pennsylvania Medical Marijuana Cards. Today, we are discussing a deeply personal and urgent topic, intractable seizures. For families and adults who have watched conventional medical treatments fall short, dealing with the daily fear of unpredictable seizures and heavy medication side effects can feel entirely exhausting.
That is precisely why Pennsylvania's legislature took a rare, highly compassionate step under Act 16. As we outline at PennsylvaniaMarijuanaCards.com, the law separates intractable seizures from general epilepsy as a standalone qualifying condition. This gives drug-resistant patients two distinct, valid statutory pathways to secure their card, ensuring that some of our state's most vulnerable individuals face zero legal barriers to care.
It is amazing that the state carved out that specific pathway. Now, the clinical evidence for cannabinoids in severe epilepsy is arguably the strongest in the entire medical marijuana field. Let's dive straight into the landmark science behind severe syndromes like Dravet and Lennox-Gastaut.
The clinical data is truly historic. Double-blind, randomized controlled trials published in the New England Journal of Medicine prove that high-purity cannabidiol, or CBD, dramatically reduces drop seizures and convulsive events. In fact, real-world data right from the University of Pittsburgh showed that over 70% of Pennsylvania patients enrolled in the state program achieved at least a 50% reduction in total seizure frequency.
Those numbers are absolutely life-changing for parents and caregivers. But your guide brings up a crucial piece of medical clarity that most cannabis websites dance around, the distinction between prescription Epidiolex and state dispensary products. Let's break that down honestly.
This is an essential point for families. Epidiolex is an FDA-approved, insurance-covered prescription oral solution consisting of nearly 100% purified CBD. It is prescribed directly by neurologists. Dispensary products, while highly therapeutic, are botanical oils and tinctures. They are not identical to Epidiolex, but they serve as a powerful bridge during insurance delays and allow adults to safely introduce small, controlled ratios of THC to help with sleep, anxiety, and caregiver burnout.
Right, they are complementary tools, not competitors. Now, let's address the most critical safety section, drug-drug interactions. Because these patients are already on heavy anti-seizure medications, adding CBD is not a casual decision. Let's start with the most common interaction involving Clobazam, also known as Onfi.
This is where active medical monitoring is mandatory. CBD acts as a potent liver enzyme inhibitor that slows down the clearance of Clobazam's active metabolite. Peer-reviewed studies in Gaston reveal that adding CBD can spike Clobazam blood levels by up to 8 times, causing severe somnolence and sedation. Neurologists frequently have to preemptively lower the prescription Clobazam dose when a patient introduces a high CBD regimen.
An 8-fold spike is massive. And what about Valproate, or Depakote? Your guide mentions that a specific lab test is absolutely required for patients on this combination.
Yes, the FDA's official prescribing data warnings reveal that combining CBD with Valproate significantly increases the risk of elevated liver transaminases. Up to 30% of patients on both drugs experience liver enzyme elevations greater than 3 times the upper limit of normal. It is not a reason to avoid the therapy, but it means getting baseline liver function tests before starting is non-negotiable. You cannot manage what you aren't monitoring.
Incredible clinical insight. Given these serious pharmacological dynamics, what is the golden rule for product selection when a patient or caregiver walks into a Pennsylvania dispensary?
The fundamental rule is CBD-dominant products only. THC is not the anticonvulsant compound here. In fact, high THC products are completely inappropriate and can actually lower the seizure threshold. Patients must look for a minimum 20-to-1 CBD to THC ratio, preferably in a sublingual oil or precise capsule format that allows for reliable, consistent dosing. Always consult with the on-site dispensary pharmacist and keep your primary neurologist fully informed.
Absolutely paramount advice. So, if a family or adult patient is ready to safely obtain their state medical certification through our telehealth clinic, what are the next steps?
We keep the evaluation process simple, remote, and fully supportive. Step 1 is filling out our 3-minute pre-qualification form at PennsylvaniaMarijuanaCards.com. Step 2 is a secure telehealth video consultation from home with a state-registered physician, like Dr. Jonathan Chance Miller. We list our doctor's active clinical credentials and NPI numbers openly on our site, so patients know they are getting legitimate, professional medical oversight.
And your practice backs that up with a total financial safeguard. If for any reason the doctor reviews their anti-seizure medications and determines cannabis isn't a safe fit, there is no penalty.
That is our trusted medical standard. If our physicians discover an unsafe drug interaction or determine you do not meet the state's criteria, your $159 evaluation fee is instantly and fully refunded. If you are approved, Step 3 is seamless. We upload your certification the exact same day. We also help families navigate the state registry to secure registration fee waivers if they participate in assistance programs like Medicaid, SNAP, WIC, or CHIP.
Honest pharmacological warnings, robust clinical safety, and completely risk-free medical evaluations. An invaluable partner for the epilepsy community in Pennsylvania.
Thank you. If you are ready to explore medically guided, risk-free symptom relief for drug-resistant seizures, visit PennsylvaniaMarijuanaCards.com. Fill out the form at the top of our page and let our compassionate team help you navigate the program safely.
Book your telehealth consultation today at PennsylvaniaMarijuanaCards.com. Thank you for listening, and take care.